Hi. Thank you. Good evening and welcome to the webinar on COVID-19. We have our panelist, Dr. Vivek Baliga, here with us today. Just to introduce him, Dr. Vivek Baliga is a consultant physician and cardiologist and is the director of Baliga Diagnostics Pvt Ltd and a visiting consultant internal medicine at Aster RV Hospitals, Bangalore. Dr. Vivek completed his MBBS from the prestigious Manipal Academy of Higher Education and has secured his membership of the Royal College of Physicians, UK, and also has completed his postgraduate program in cardiology from Johns Hopkins University. Now, given his enthusiasm in business, Dr. Vivek continued his education by pursuing an MBA from University of Phoenix, USA. Dr. Vivek is responsible for the publication of Saukhya magazine and online health blog HeartSense. He has been a part of various medical conferences as a speaker and panelist and has numerous publications to his name. We at Ripples are delighted to have him over to be a part of this initiative to make individuals and organizations more aware of the COVID-19 and the evolving situation. I actually now hand over the webinar session to him. Thank you, Doctor, for being with us and welcome.
Thank you, Veronica. Very good evening, everyone. First of all, I would like to thank the team from Ripples Learning and CHRMP for inviting me to talk on a very valid topic, a hot topic, that is coronavirus, keeping safe the right way. A very kind introduction is already made about me, so I'll just move on and discuss about this virus. And you might have seen these headlines in the papers recently. Death tolls, confirmed coronavirus cases. There's even some cases now in Bangalore where I'm currently seated at. And obviously there is a fair bit of concern amongst the general public about how quickly this virus is spreading. But the important thing to realize is that viruses are there all the time. What we need to do is take the right steps to try and prevent the spread of the virus between people. So this is what I'll be covering. So what I'll discuss today is briefly the introduction to the virus. How does it spread? What are the symptoms to look out for? How it is tested? What are the treatments and how it can be prevented? I'll probably cover a few myths as well later on, something that could quite interest you as well. So to briefly give you an introduction, the coronavirus outbreak started in Wuhan, China, and it's making headlines. Obviously, many of us are worried. The first case was reported on the 31st of December. It's New Year's Eve last year. And since then, cases have cropped over all over the world. And in fact, I think as of today, there are nearly 112,000 people, 120,000 people, in fact, affected by this virus. In India, there have been reported cases in Kerala. There's been one case in Gurgaon. There's been some confirmed in Bangalore as well. So we're still on the lookout for new cases. So obviously, a lot of us are keeping up to date with that. So what I thought I would share with you is a brief overview about what this virus actually is and what you need to look out for, how it spreads, and what you can do to prevent yourself from catching this virus. So the coronavirus is not really anything new. It has been there for quite a while. It is a class of viruses that is found both in animals and in humans. Previously, there have been described conditions, the Middle Eastern respiratory syndrome. They also call it camel flu, is seen in the Gulf, in Saudi Arabia and Dubai. And there is the severe acute respiratory distress syndrome, or SARS, which you may remember was in the news a few years ago. And both of these are coronavirus infections. But this time, the coronavirus is a slightly newer one. It's not similar to the MERS virus or the SARS virus that I've just mentioned to you. And it seems to be affecting people. It's now called the 2019-CoV virus. Excuse me.
Just a minute. We need to record. Yeah, sorry.
Okay. Sorry for the interruption. So I was mentioning that the coronavirus is a virus that is affecting a lot of people across in India. And this novel coronavirus is the new virus, sorry. So it was initially called the 2019-nCoV, but now it is called the COVID-19. The COVID stands for, CO stands for corona, VI stands for virus, and D stands for disease. And since it started in 2019, it's the COVID-19. It was called the novel coronavirus primarily because it has not been reported in humans so far. It is a novel virus in humans. So how did humans get affected? It was believed that the virus originated from a live animal marketplace in Wuhan. And this is a place where they were selling rabbits, snakes, pangolins, and other animals. So it's believed that one of these animals was carrying it, and somehow it spread from the animal to the human, and from one human to another to another. The primary people who are at risk, this is always a concern, but what we have found so far from the available information that we have is the people who are elderly and those who have a history of some medical illness that has dropped their immunity, things like diabetes, high blood pressure, HIV infection, multiple chest infections, those with lung disease, etc. Those are the people who are more vulnerable to developing this condition. However, children, while it is rare, it is not unheard of. So there are lesser cases in children because generally they can fight this infection a little bit better, and younger individuals can fight it. But coronavirus infections have been seen in this age group as well, though the elderly and those with other lower immunity conditions are the ones that are at a higher risk. So what are the symptoms? So initially when the virus affects an individual, the symptoms don't start immediately. It takes anywhere between 2 to 14 days for symptoms to crop up. That is why a lot of times if you're on quarantine, the airlines or whatever, if you're flown in from a country abroad to India or wherever, if you're flying abroad or whatever it may be, they will ask you to keep an eye on your temperature and any symptoms. They may call you every day for about 14 to 15 days to find out if you have had any symptoms. That is because that's the duration that it takes for the virus to build up in the body. So after the period of the 2 to 14 days, what is called the incubation period, or the time when the virus starts to build up, the symptoms primarily are fever, that is seen in almost 99% of cases, a cough, and breathing difficulty. The fever seems to be the most common symptom. Cough is the second most common thing. Breathing difficulty is seen in more advanced condition. These are the patients who need hospitalization. Some people also can get body pain. Runny nose, throat ache, etc. are less common in coronavirus. They generally are the flu virus. That is the common cold that we have all been experiencing in the winter months. So if you have a runny nose, a headache, etc., it is less likely or unlikely that you have the coronavirus symptoms, at least the ones that are described by the WHO and the Center for Disease Control are high fever, cough, and breathing difficulty. So when you have or suspected coronavirus, the first thing you should do is go and either quarantine yourself. I'll talk about what preventive measures you should take. But the first thing you should do if you're worried is to go and see a healthcare professional. Talk to the doctor, discuss your symptoms with them. And if there is a suspicion that you have coronavirus infection or COVID-19 infection, then you may require further tests. And the tests that are currently done are oral swab and nasal swab. And the reason for this is this condition is spread through droplets primarily. Say, for example, you are close to an individual who has carried the virus or is actively affected by the virus. If that person were to cough or sneeze on your face, then it would enter through your nasal passage or it may enter through your oral cavity. And what it goes and does is it sits in the tiny cells that are present within your nose or within the oral cavity, and it starts to multiply. And that's when it starts to cause the symptoms. So what doctors will do or lab professionals will do is they will take a swab from the oral cavity or a swab from the nasal cavity. And that swab is then subject to certain investigations, certain tests. The primary test that is done is something called RT-PCR or reverse transcriptase polymerase chain reaction. I don't expect you to remember that thing. But that test is a test where they multiply the basic, what we call nucleic acids that are within the virus. That is multiplied in a controlled environment. And if there's even one copy of the virus, that gets multiplied many-fold, and that can be then detected. So it can take a few hours for that report. However, it is very clear that the RT-PCR test is the best way to diagnose coronavirus or COVID-19. Blood tests are done mostly to rule out any other infection. They're not necessarily good when it comes to diagnosing COVID-19. But if you have, for example, a chest infection, you may have a cough and you may have fever as well. So sometimes a blood test can be helpful in determining whether you have that or whether you have a COVID infection. When a blood test is done, one of the things that we look at is to see whether a particular type of cell is reduced in number. So if you have ever had a blood test before, you may have seen something called a white blood cell count. A white blood cell count, or a leukocyte count, what we call in medicine, is actually your body's defense against infections. They are your soldiers within the body that help fight any infection that may enter your system. In a bacterial infection, so say for example, you picked up a chest infection, you're coughing a lot of phlegm or something like that, the total white cell count tends to increase. But in a viral infection, the total white cell count tends to come down. Now, it is not specific for COVID-19 having a low white cell count in your blood report. So don't panic if you see a total white cell count lower than normal. Even a regular flu or viral illness can cause a low white cell count. So there has to be a higher suspicion because of travel or any exposure for COVID-19. And just getting a blood test is not important. If your doctor feels that you need to go and get an additional test, then an oral and a nasal swab is the best way to get it done. So if you were to, God forbid, pick up the condition, or if someone you know or care about picks up the condition, what sort of treatment can they be offered? Now, currently in Bangalore, there are 1 or 2 hospitals that have the facilities available. They have isolation wards available. Private hospitals are still setting up the wards for this. The Victoria Hospital and the Rajiv Gandhi University Hospital are the ones that have currently set up in Bangalore. If a patient has a suspected COVID infection, then they'll be quarantined in an isolation unit. Adequate measures will be taken to prevent spread to other individuals. If patients have got breathing difficulty, or if they have cough or they have high fevers, they may require admission to an intensive care unit where drips will be started so as to hydrate the patient, and blood pressure monitoring will be done, because a lot of times, or in those who are seriously affected, the blood pressure can tend to come down, and these patients require very intensive monitoring and treatment. But not everybody requires this. A majority of the patients, I would say nearly 98% of patients possibly, would have a mild infection, and generally patients get better in about 2 weeks' time. Those who are elderly, those who are more vulnerable, tend to have a longer course of the infection and may have some problem recovering quickly. So it can be maybe around 4 weeks or so before they completely recover. If there are any questions, I'll take the questions at the end of the session. That's okay. I'll complete the presentation and then we'll go through the questions. So this is the part I would like to talk about in a little more detail. Prevention of the COVID-19. This is the most important thing that you should know. There have been a lot of myths, a lot of misinformation that is being spread on social media, and I guess that's one of the problems with social media. But what you do need to know is what I have discussed over here is based on the guidelines that have been issued by the Center for Disease Control and by the World Health Organization and by some local bodies within India and abroad. The most important way to prevent this infection from spreading from one person to another is hand washing. Now, the virus, if an individual coughs, the virus floats in the air. It can float for a particular distance, after which it starts to settle on a surface. Now, if, for example, you are sitting in front of a keyboard and you have, or a computer, sorry, and you have a cough, you cough onto the surface of the computer, the virus can last or can sit on the keys for a few hours. It is not very clear how long it is. Nobody has that information yet, but it is believed that it will be lasting for a few hours or so. And during that time, if somebody were to use the keyboard and then were to touch their face, or say put their finger in their mouth or for something, bring their hand close to their face, then there could be an entry of the virus into the nasal passage or into the oral cavity, and that's how that person can get infected. So most important thing is to wash your hands. Make sure that you wash your hands with soap and water. That is the best way to do it, because hand sanitizers, as many of you will know, are nowadays not available. Everybody has panic bought a lot of them. But soap and water, good quality soap and water is more than enough. The guideline is to wash your hands with soap and water for at least 20 seconds. Now, if you don't want to count 20 seconds, you can do something as simple as sing the chorus of your favorite song twice or something like that. That'll kind of give you 20 seconds of your time. Now, do it as often as possible, and then dry your hands with a clean cloth. That's also important. If you have anybody with a viral infection who's already got COVID-19 and used a cloth, do not use that to dry your hands. Even if you wash your hands, you can still pick up the infection from that. If, however, you're not close to a wash basin or soap or anything like that, carrying a sanitizer, a hand sanitizer, can be just as useful. But once again, no ordinary hand sanitizers are helpful. The guideline again suggests that these sanitizers should be alcohol-based and should have at least 60% alcohol in them. Most of the medical ones that we use in the hospitals are around 75% alcohol, the ones that we have by the bedside. 60% alcohol is the minimum requirement for hand sanitizers. Some of them go up to 95%, but then that would be probably difficult for you to get. So 60% alcohol would be more than enough if you can get one of those. The primary use of hand sanitizers is to kill the virus that's on the surface. One more thing that is important for you to do is to keep your hands away from your face and your nose. If you're carrying the virus in your hands, if you accidentally or willingly touch your face or nose for some reason, then you can cause the virus to enter your nasal or oral passage. So whatever surface you may touch, doorknobs, etc., and I'll talk about this a little bit later, it's quite important that you wash your hands. Just be very careful. I know it can be a little difficult to go on washing your hands all the time. So maybe carry a sanitizer around and just use it. Commonly used surfaces, keyboards, mobile phones, especially mobile phones are very infectious gadgets. Nobody realizes how bad mobile phones can actually be in terms of infections. They carry tons of bugs on them because we hold them so close to our face and mouth all the time. So that's another thing that you'll have to be very careful with. Now, keeping a distance from an affected person is very important. In this slide, as you can see, I've mentioned 3 feet, but recently the guideline has changed to 6 feet. So that's about 2 meters distance. And it is believed that if an individual coughs or sneezes or anything, whoever's carrying the virus sneezes, then that sneeze will not, the air droplets will not travel as far if you stay a distance away from them. If you're close by to them, there's a high likelihood that a few droplets will fall on your face or any surface of your body, and then you can pick up the infection. Now, masks, I have seen not only in my clinic, a lot of places, public places, etc., people wearing masks. Now, unfortunately, there is some belief that masks can prevent you from picking up the infection. That is not entirely true. Masks only have a very limited role. And in fact, the guideline currently recommends that only people who are affected by the virus or those who have actively coughing or sneezing or have a viral infection, those are the ones who should be wearing a mask, not the ones just sitting near them unless you're at close proximity to them. If you're sitting further away, there's it's highly unlikely that you're going to pick it up directly. There is a shortage of masks, I think, now, along with the hand sanitizers, and I think there's a big markup in the price of masks as well. It's a shame, but it's happening. But just remember, there's no need to panic buy masks. If you are maintaining good hand hygiene, if you are keeping distance from affected individuals, then it is highly unlikely that you're going to pick up this virus from anyone. So don't need for you to go and buy masks or anything like that. So that's the key thing. The key message is not for you to panic. I think there is a lot of panic spreading around. Again, social media is the problem. News articles would publish anything to do with deaths and in number of rising incidences. But what has not been discussed is how many people have actually recovered from the problem. So there are many people who have actually got better and have gone home. The mortality rate for the virus is in fact just 2% fatality rate, as we call it. That is, out of 100 individuals, 2 affected may not survive the infection. What has been found from the available information that we have is those people who have not made it are those who are elderly or those who have low immunity. If you are young, if you have a good immune system, if you follow a healthy lifestyle, if you exercise regularly, then your immunity is likely to be higher and is going to be able to fight this infection. So it's very important that you practice a healthy lifestyle to make sure you stay healthy. And that way your chances are less. Now, 2% seems like a large number. And it is not. It is certainly looking like a large number at the moment. But over a period of time, that number is going to drop because there are more and more people who will get better. And then the subsequent fatality rate will start to come down. The common flu itself, the normal flu that we have itself, has a mortality of nearly 1% or just under 1%. So it's not a big difference compared to the normal flu, the runny nose, cough, and sneezing that you can get. And not many people are worried about that because it's such a common thing. And because this is a novel problem, a lot of people are quite concerned about it. But as I said, there's no need for you to panic. Just follow the preventive measures and that should be enough. The SARS virus that affected us a few years ago, that actually had a mortality of 10%, which was very high. But eventually the infection died on. That as well died down very fast. And there are hardly any reported cases of that at the moment. So that's basically the meat of the presentation, but I thought I'll cover a few frequently asked questions that are discussed on forums and some of the stuff my patients have asked me. The first thing is, how does the virus spread? Again, there is misinformation. I have seen WhatsApp forward saying that on metal surfaces, it lasts for so long. On this surface, it lasts for so long. It's actually not true. Primarily, this is airborne. If someone coughs or sneezes in your and is at close proximity to you, then there's a chance it can the droplets will fall onto your mouth or your nasal cavity or something like that, and then it can affect your your immune system and start to affect you in general. But if there are infected surfaces, as I've talked about, computer keyboards and doorknobs, mobile phones, those sort of things, the virus can sit on them and can be viable for hours. There is some evidence that it might be viable for days, though that is still not very clear yet. I think we still need a lot more information because it's a new virus, and we're still trying to figure out a lot more about what exactly or how exactly this virus lives and how it proliferates and grows. Travel. Now, there are a lot of people wishing to see family in the US or wanting to go to Europe or have already got their holidays booked to different parts of the world. The current guideline by the CDC is to avoid all non-essential travel to affected areas. So there is something called level 3, level 2, and level 1 areas. The level 3 areas are places like China, South Korea, Hong Kong. These are the areas that you wouldn't want to step foot in at the moment. There are areas where there are few reported cases where parts of the area are safe, parts of them are not safe. Those are the areas, again, that you still want to be a little bit cautious. But they do state that if there is no area, there's an area that is not affected yet, then travel should be generally quite safe. But the general advice we as physicians are giving our patients and the general public is, unless it is absolutely essential for you to go, that it is an emergency, try not to travel. Try and postpone your travel. All non-essential travel, please wait if it can wait. Another thing we're telling is if a person has low immunity, has a long history of lung disease or cancer, or they've had some chemotherapy, etc., or they're elderly, past 70, 75, and they have other medical conditions, high blood pressure, diabetes, those sort of things, then try and avoid travel as much as you can. Maybe stay limited to your house and nearby your house till we have more information and till we know what is safe and what is not safe. Now, what about your house, keeping your house clean? If an individual at home has been exposed to the virus, then we are advising something called local quarantine or in-house quarantine. So we advise them to stay at home and just wait it out, because many times the patients get better within about 10 to 15 days. So if there is someone at home, the rest of the family is obviously going to be worried. So they are close contacts. For them, there is an advice to wear masks. But more importantly, there is an advice to keep the house spick and span. So use an alcohol-based cleaner with at least 70% alcohol. Just an example, 70% alcohol is quite a high concentration alcohol. Your regular vodka is only about 40%. So don't try and use vodka, but just use a regular alcohol-based cleaner at home. Home-based disinfectants are quite good. They should do the job. There are quite a few brands available in the market, so you can find any one of them. Those that kill the normal bugs are enough. And if the surfaces are dirty, so if there's mud and things like that, then don't use a disinfectant first. Use soap and water, clean the surface, and then use your disinfectant on top of that, and that will definitely kill the virus. When you're hand washing, there are ways to wash the hand. You're supposed to do it for at least 20 seconds, like I mentioned. And if you're using a sanitizer, use one with at least 60% alcohol content in it. The recommendation is to wash your hands after, say, for example, you coughed or sneezed or blowing your nose. One of the things you can do if you don't, you can cough if you don't have a handkerchief or a tissue or anything like that, is to cough into your elbow. So some people can do that, and you can cough into that, and that will prevent it from spreading. And then immediately wash. That's important. We advise against using handkerchiefs. A good thing would be to use tissues. So once you've coughed or sneezed or anything into a tissue, dispose of the tissue immediately into a dustbin or anywhere safe, and then wash your hands with soap and water. Also make sure you wash your hands after you use the restroom and after you've eaten food as well. So any sort of thing, then the regular washing of hands that needs to be done, these are just basic things that we would tell anyone anyway. There's no special circumstance here. These hand washing tips are given for everyone. So it's important to just do them. But in this certain situation, just be a little more vigilant. That's important. So some people have asked about the flu vaccine, whether the flu vaccine prevents the COVID-19 infection. Unfortunately, it doesn't. The flu vaccine is designed against the regular flu and the H1N1 virus. It has absolutely no protection against the COVID virus because they are different viruses. They don't fall in the same class. The flu vaccine or the flu virus is actually the influenza virus. The COVID is the coronavirus. They're completely different. There are, of course, medical groups that are currently in process of trying to synthesize or manufacture a vaccine. They are taking blood from healthy people who have survived the COVID virus, and they're taking blood from them and trying to manufacture the vaccine. So it might take a little while, and there's some belief that it may be, or somewhere I read that in one of these sites that there might be at least 2021 before the vaccine comes out, really. So it might be a while before we have a vaccine. What about pregnancy? This is a big concern. Obviously, there is not enough information that we have got regarding pregnant women getting affected by the COVID virus. However, in the past, the coronaviruses, that's the SARS virus, infections in pregnant women, has led to miscarriage and stillbirth. High fever in the first trimester of pregnancy, that is the first 3 months of pregnancy, is known to cause birth defects. And we still don't know whether if the mother affected can transmit the COVID virus to the growing fetus. So unfortunately, there is no information on this yet. I'm sure at some point there will be some information out soon. So make sure you check on the CDC website or the WHO website, a reliable website. Please don't use WhatsApp messages. Don't believe stuff that is being circulated online. Physically visit a website, the cdc.gov website or the WHO website, or if you're wondering about children, you can go to the UNICEF website. Those are the websites you need to trust because these are health experts who have talked about it. So now what can organizations do to prevent the spread? Now I know that a large number of you will be working in office spaces. You're probably a part of a bigger organization, a bigger company. So the key thing is for employees who are sick. If you have an employee who is sick, HR organization, HR units or HR teams need to make sure that they are actively encouraged to work from home, or they should guide them to a physician who can take care of them. If there is any concern, then ask them to stay at home. Actually, quarantining them at home is much better than asking them to come to work and work in a more isolated space. That is not something we would recommend. Of course, policies may need to be changed for a while. Leave policy changes need to be made to accommodate this prolonged period. Generally, people who have been affected may require up to 2 to 3 weeks leave. This is because it takes up to 14 days, at least that is our understanding, for the infection to manifest. But if the infection has started already and a person has been diagnosed with the virus, then it can take up to 2 to 3 weeks for them to get better again. So you have to be understanding regarding this because one person can affect many if they come to the office. So just encourage them to work from home. If an employee arrives sick to work, then separate them straight away from the employees or just make them go home and encourage them to continue work from home, provided they are fit enough to do so. This is something called social distancing that you may have heard of if you've seen enough videos on this condition now. Social distancing is just keeping people at distance. So I've talked about 6 feet distance, but if somebody is sick, send them home. Now, there are other things you can do in an organization. One of them is to place posters around the office that reiterate hand hygiene, keeping tissues that employees can use when they're coughing, and also guiding them on additional preventive measures. If you can obtain or procure alcohol-based hand rubs from many companies, then keep a few around the office so people can use them as well. As I said, keep those hand rubs that have between 60 to 90% alcohol in them. And hire cleaning staff to clean frequently touched surfaces with a good quality disinfectant, so keyboards, doorknobs, countertops, desks, all this sort of thing. And avoid sharing mobile phones. If you're, for example, watching a video on Facebook or on YouTube and you want to show your friend a video, don't do that. Right? Just keep the phone with you and maybe just tell them what it is and let them watch it on their own phone. So now I thought I'll cover a little bit of the myths. Some of them are quite amusing. Obviously, you get a chuckle now and again from seeing what you can read online. There is some myth about garlic preventing coronavirus infection. Now, garlic no doubt has antibiotic properties, antibacterial properties, but it doesn't have antiviral properties. This is a virus, it's not a bacteria. Garlic is not bad for health, it is definitely good for health, but there is absolutely no evidence to suggest that garlic can prevent you from getting coronavirus. Gargling with salt water prevents infections. Again, not true. There is no evidence to suggest that is the case. Yes, we do advise patients to gargle with salt water. That is mostly to help them reduce the swelling and to reduce pain, but it doesn't kill the virus. Even if you have a normal viral infection, the gargling with salt water doesn't kill the virus. It just helps reduce swelling and give some relief. Antibiotics can kill the coronavirus. This is another thing that I've heard. Not true. It's a virus. Antibiotic works against bacteria. So they are completely different classes of infective organisms. They don't work in any way. So even if I were to prescribe you an antibiotic, you probably have the same duration of the illness were you to suffer from the COVID-19 virus. So it's not going to work. It'll be just a waste of time, and you may develop diarrhea from the antibiotics. And cats and dogs can spread viruses, this coronavirus. That again is not true, but there has been one reported case where an owner has passed on the infection to a cat. The cat had the virus, but there was no symptoms in the cat whatsoever. The cat is perfectly fine, jumping around, absolutely no problem for the cat. So these are some of the myths. I'm sure there are plenty more circulating online. There is some about temperature. I'm sure you may have questions about that. There's some about the type of masks you can use and things. So if you have any questions, maybe you can address that later. So that's the end of the discussion. I hope you found it informative and useful. I think it's time for us to move on to some questions. So can we move on? Yeah. So I'll just move on to the chat window here. Yeah, you can type your questions in the chat. I'll just ask my friend to assist me with this. Correct?
Yes. Hi, everyone. This is Anindita here. So, yeah, we have few questions already there. Yeah. There are rumors that consuming alcohol kills.
Well, I'll start with, I think, the first question by Motorola One Vision. I think there's a question there that says, so my question is, during summer, is it normal for one to catch a flu during the summer season? So if you have a slight cold or cough or cold or phlegm, is it because of the current virus? So the weather, generally, viruses are more active during the winter months. That we know. The common cold, the normal flu that we get is more common during the winter months. During the summer, you can still pick it up if your immune system is a little weak. With regards to the COVID-19, there is another question about 27 degrees that I'll cover it in this question itself. That is not really true because we don't know. Now, if you look at the SARS, if you look at the MERS and the SARS, which I mentioned at the start of the talk, the SARS virus is believed to be the most closely related, like a close cousin of the COVID-19 virus. And there were still reported cases of SARS during the summer months. Also, the SARS virus was mostly in the Middle East. The MERS virus, for example, is in the Middle East, but the temperature is quite high already. And that virus is able to thrive in that temperature. So a lot of people pick up the camel flu, etc., in the hot, scorching sun. So this is not clear yet. I think time will tell. We will know once the summer month kicks in, whether the virus is going to be still active or not. So I'm hoping, or we are all hoping in the medical community, and I'm sure the general public is, that this virus dies down as quickly as possible and doesn't survive. But I guess time will tell, and then we will know for sure. There's another question on rumors that consuming alcohol kills the virus. There is no such thing that we're aware of, only rubbing the alcohol. And remember, consuming alcohol, I told you, the alcohol that we consume generally is around, in wine has, I think, about 10% alcohol, possibly vodka is about 30-40% alcohol. What you need is 60% alcohol. And if you try and down a 60% alcohol, I'm sure, I've not tried it, I'm sure that it'll burn your throat, it'll burn your food pipe. So there is no truth in that. So we have covered the next question. Let's see, social media can, yes, we've covered that. How can we make our immune system stronger? That's a very, very good question. The most important thing to make your immune system stronger is a healthy, balanced diet and plenty of exercise. We know from years on end, this is not something new, that if you eat your veggies, if you eat your fruits, you get all the vitamins, all the minerals that your body needs to have an active immune system to produce enough blood, to produce enough white blood cells. And if you exercise more, you will have a stronger immune system. Your chances, your digestion improves, your heart health improves, your brain health improves, your kidney health improves. So everything gets better if you exercise. Now, vitamin C has been shown to be a powerful antioxidant when it comes to the common cold and the flu. So there are some proponents of taking vitamin C. You can get that from oranges, you can get from grapefruit, you can get that from numerous other citrus fruits. So having a good amount of vitamin C every day can help build up your immune system and fight viruses in general. Whether it works against the COVID virus, well, I'm sure it will do. I'm sure building your immune system will help. But there are other factors that affect your immune system, things like the environment, pollution, etc. They can all weaken your immune system. So unfortunately, we live in a place where we have to fight against so many other factors to build our immune system. So try your best to exercise at least 30 to 45 minutes a day, some form of cardio, follow a good, healthy, balanced diet, avoid fried foods, oily foods, salty foods, sugars, sweets. Those sort of things cause a lot of inflammation in the body and can reduce or make your immune system weaker. The presentation, I'm sure the team will share with you. Then we'll move on to one more question. If someone has a cough for 3 months or a sore throat for 1 month, can be a common cold or allergy. The virus usually finishes its course in about 2 weeks. So if you have a cough for 3 months, it is highly unlikely. But in fact, if you have a cough for 3 months, you actually need to get yourself investigated. Cough for 3 months could be a chronic, what we call allergic cough. Sometimes it could be a mild bacterial infection that needs evaluating through a chest X-ray. And one of the tests that we do for suspected coronavirus patients who have got high fever and cough is a chest X-ray. So that may help a lot. Get a chest X-ray done. The findings on a chest X-ray in coronavirus infections are quite classic. If you have a normal chest X-ray, it doesn't necessarily rule it out, but a 3-month history of cough is unlikely to be COVID-19 infection. Will gyms increase exposure to the virus? Again, good question. It is an enclosed space. It is not unlikely. It is likely that it could do. In fact, there are in Italy, I think, there is a current surge in coronavirus cases. They are now advising people not to visit gyms. They are enclosed spaces. The places that you would try to avoid, other than the office spaces, are gyms. In fact, ship travel or the cruises are something that they have, advised against. Airplane travel, for example, within the country, for example, there is some understanding that the filtering system within the plane and the air conditioning and things like that may prevent the spread of the virus. But that being said, if you're sitting next to someone with a viral infection, you can pick it up as well. So it's not clear again. There is no solid evidence for me to tell you with 100% certainty that it won't. What I can tell you is be careful. That's all. If you find somebody coughing and sneezing, stay at least 6 feet away from them. In which stuff has maximum vitamin C? So our good old gooseberry, amla, is very high in vitamin C. You can get vitamin C from all citrus fruits. So your oranges, Mosambik, grapefruit, pineapple, grapes, pomegranate, all this has vitamin C in it. I think a good source of vitamin C is also broccoli in amongst the vegetables. So you could try that as well. I think spinach also has a good amount of vitamin C in it. Does coronavirus spread through food? No, there is no evidence that it does. So there are some things going around that don't order Chinese food and all that sort of thing. Unfortunately, that is not true at all. Remember, the food is cooked. It is heated to very high temperatures. It is unlikely that it spreads through food. It does spread through droplet infection. Now, that is not to say that if somebody would cough on the food and you ate it straight away, that it would get it. It is possible, but say, for example, somebody has cooked the food and things like that, it is highly unlikely. So unless I may have a follow-up session on this or a follow-up email to the Ripple's learning team on this if there is more evidence regarding this. So keep your ears to the ground and I'm sure you'll get some more information on this. If COVID-19 is contracted, whether the treatment will be completely a hospitalized one or will be like just any other flu treatment. It depends upon how ill you are. So if you have just a mild infection, then they will ask you to stay at home. You may go to a hospital, they'll say, go home, and lock yourself up in your room or something like that and tell the ideal sort of preventive measures to the family. And they will ask you to just wait it out. But if you start to become breathless, or you notice that you're not able to even walk short distances, or you find that when you come to the hospital, they find your oxygen levels are low. In that situation, they will certainly advise admission. It is recommended to get admitted because you can't be treated at home in such a situation. Mild cases can stay at home. The more severe ones or definitely require hospitalization in an isolated ward. Regular hospitals, a lot of the hospitals may not take you up. They may ask you to go to a different place where they have dedicated units to handle this problem. If there are any other questions, please do ask them. Does our government I don't know. You'll have to ask Prime Minister Narendra Modi that question. Does our government have the capacity? I think we always have the capacity. If we really put our mind to it, our government can do anything they want. That's my personal opinion. I really feel personally that there should be steps that are taken that allow people to control this, and people shouldn't be charged for it. I really feel that the care should be given free of charge. If a vaccine hopefully comes out at some point, that too as well should be given free of charge to all the people, which is the right thing and the ethical thing to do, I feel personally. So let us see what the government does. They've done the phone messages, which I'm sure you're all very excited about, or probably a little fed up of, but that is a good initiative. The government does have a helpline number, so you can check it out online. If you have any concerns, you can call the helpline, and they will guide you to the nearest hospital place that can handle it, or at least give you the advice that you need regarding handling this. What are the chemicals? Dettol, Lysol, bleaching powder, etc. So if you look at the CDC website, they have told you that they've said very clearly that you can use a particular concentration of bleaching powder in a particular quantity of water. Now, I can't remember the exact quantity of bleaching powder, but I do advise you go to the CDC website, and it's all very clearly laid out there about house cleanliness and what you can do. Dettol and Lysol are good disinfectants. They are good quality disinfectants. And if there was, fortunately, they haven't gone on and advertised it and tried to, push that product. But I do feel that these are good disinfectants that kill 99% of germs, or at least what they tell us. So I would say use a good quality disinfectant, or visit the CDC website and have a look at the bleaching powder, the guideline that they have, and that will tell you. Another question from Aaron. I need to ask a few more questions. Rumors say that eating chicken can or may cause or giving away for the infections from chicken. Yes, the chickens don't carry this virus. In fact, it is airborne, so it's not foodborne. Foodborne viruses are hardly any. Most viruses are airborne. It is bacteria that are foodborne, because if it is improperly cooked, you get a bacterial infection, but you don't get viral infection from eating chicken. At least that's not what we know. Taking vitamin C tablets every day will help. That is what we are advising. There are brands available widely, so you can ask your local pharmacists for that. Fruits are a very good source. I am always a proponent of natural sources of vitamin C, or any whatever vitamin or protein that you're looking for in your diet. Multivitamins and vitamin C supplements are advised to someone who is not able to have adequate food intake, say an elderly person who's got, or somebody who's got severe gastritis, an elderly person who's not able to handle, a large diet. Those sort of patients can take vitamin C supplements or any other supplements. Vitamin C is available in a chewable form. There are chocolates and sweets and things like that. I think they're available abroad. In India, you do get vitamin C chewable tablets, so you can buy them over the counter. You can take one a day, and that should be enough. Otherwise, just have 2 citrus fruits a day and a good quantity of broccoli a day, or something like that, and that should give you your vitamin C. If someone suspects to have coronavirus, what is the recommended course of action? That's a good question. First thing is you could call your doctor before going to your doctor. You could call them and discuss your symptoms with them. If your doctor feels that you have symptoms of the COVID-19 infection, then they would guide you to the nearest hospital that is equipped to handle it, rather than calling you to their clinic. It is less likely they will call you to the clinic, because if you have an infection, then you are at high risk of spreading it to other individuals. It is better to go to a center that is equipped. In Bangalore, it is Victoria Hospital and Rajiv Gandhi University Hospital that are currently equipped for handling this. You can ask your local council or whoever it is, or which hospitals are equipped in your state regarding managing this virus. But if you've got a mild infection, you're very likely to be asked to stay at home. If you have a severe infection, if you're breathless or your cough is really bad, if temperature is not subsiding, then yes, you can go to the nearest hospital. That's quick. Are the testing facilities limited to government hospitals? At the moment, yes. Mostly because private hospitals haven't received any sort of guideline or any directive from the government on how to handle it. And furthermore, there are very select number of cases that are going to be tested. This is because the kits will just run out. If each and every person with a cough and fever starts to go to every testing facility, within no time we'll run out of testing kits, and the people who really need the help will not be able to get the help. So speak to your doctor first and then take their advice. If there is a suspicion, that suspicion will be mostly based on your travel or a family member or a close member's travel to an area that has been affected. If you have been living in a place where there has been no reported cases whatsoever, and it is highly unlikely that your cough and fever is your coronavirus infection, it might be something a lot more simpler and that may get better a lot quicker. Are there any other questions? Please feel free to ask. Have you found this talk useful? My pleasure. So thank you very much for your kind attention. I hope you found the talk useful and informative. I'm sure there will be a follow-up presentation or at least an email or something like that from the Ripples Media team. Please do feel free to forward it to whoever you wish to. I'm very happy if more people get the right information and do the right things to prevent this infection from spreading to others. Thank you very much. Yeah, you can present it.
Yeah. Okay, thank you everyone for being there. Okay, and as Dr. Vivek said that we will be getting back to you with an email regarding the things. And thank you so much, Dr. Vivek, for being here and giving us a lot of insight about the COVID-19. And we will catch you next week. Thank you so much.
Thank you.